Alzheimer's is one of the most common age-related conditions in the United States. It affects the lives of over 5 million older adults in the country. As more Americans get older, the number of men and women with Alzheimer's is expected to triple in the next 30 years. Because of this daunting fact, there is an exceptional amount of research going into the treatment and prevention of Alzheimer's and other forms of dementia. A recent study published by researchers at Temple University explores the link between elevated homocysteine, vitamin deficiency, and Alzheimer's. High levels of homocysteine are known to vastly increase the likelihood of dementia, potentially up to 10 times. There are several ways that elevated homocysteine is dangerous to brain function and health. It impairs memory, reduces blood flow in the brain due to plaque formation, and it leads to chronic inflammation. Furthermore, homocysteine elevation leads to the development of dreaded beta-amyloid plaques and tau tangles. These formations make it more difficult to repair DNA, leading to malfunction and disruption at the genetic level. In one study, the risk of vascular dementia increases 4 to 10 times as a result of high homocysteine, and the extent of cognitive impairment was closely correlated to the degree of homocysteine elevation. While homocysteine is a strong risk factor for cognitive decline, dementia, and Alzheimer's, it's also a treatable health issue. By lowering homocysteine, it is possible to mitigate the risks associated with these conditions, along with the brain damage. A new study printed in Molecular Psychiatry connects homocysteine elevation to B vitamin deficiency. B vitamins help deconstruct proteins and detoxify the brain. Without sufficient B complex vitamins, the brain can't effectively remove waste, increasing the risk of neurological issues and deterioration. In this study, mice experienced induced B6, B9, and B12 deprivation. After 8 months, the rodents experienced a 50% increase in tau tangles along with significantly increased homocysteine. This was also correlated with an increase in 5-LOX, a chemical that exacerbates inflammation. After this sustained period of vitamin deficiency, the mice experienced serious issues with maze navigation. While the focus of this research is on the effects of homocysteine on the brain, the dangers of elevated levels of this amino acid don't end there. It's also very dangerous to the cardiovascular system, increasing the risk of carotid artery constriction, plaque deposits, and blood vessel damage. Elevated homocysteine significantly increases the risk of stroke and heart attack. It also prevents the vascular system from bypassing blocked blood vessels. One piece of research estimated that every 5 millimoles per liter homocysteine increased the risk of adverse cardiovascular events by 25%. Homocysteine levels naturally rise as a byproduct of aging, largely because the body detoxifies less efficiently. Prescription drugs, stress, and genetics also contribute to increasing homocysteine. It's strongly believed that B complex deficiencies, which are also correlated with age, are among the biggest contributing factors. If you're interested in reducing the risk of age-related conditions associated with elevated homocysteine, we can arrange for a blood test that will help diagnose vitamin deficiency and measure your homocysteine. The older that you get, the more important it is to get tested. If you would like to contact a hormone specialist about getting your blood tested for homocysteine or any vitamin deficiency, just click the link below in the description of this video.